We found most of my last appointments, a lot of them got cancelled. I think because of lack of resourcing, like not wanting to take the risk of going into the hospital. But in hindsight, I think if I hadn't missed some of those last appointments, my birth experience might have been a bit different. I remember having contractions on my own, like folded over a bin basically in the hospital, and just feeling really alone. My daughter was breech, and so I was told emergency C-section. So as they were kind of undressing me and getting me prepped for surgery, I was frantically trying to call my husband, who was downstairs in the car park, to get him to come up, and it was just all very, very rushed. But he made it up as I was basically being wheeled into surgery. So I think before the birth, up until COVID, perfect, it's amazing. I think before the birth, when COVID restrictions hit, it was challenging and it was a lot less contact than I think what you'd normally expect. I can kind of understand that because COVID was so new and unexpected, I think. I think being a first-time mum, labour, like, you didn't really know what to expect. And I think, in hindsight, if I'd been able to have Dan there with me, he could have advocated for me more or just had somebody on my side, whereas I just kind of went along with what I was being told. And then I was moved to the post-labour ward, or that postnatal ward. And that was quite difficult. I was put on a bay quite far away at the end. And that's where I felt that the support just disappeared. Part of the rush to give birth meant that Dan didn't bring up all of my belongings. So we had the baby bag. I didn't have my own bag, so I didn't have any clothes. I didn't have a water bottle, and he wasn't permitted to go back and get it. So I was just left with nothing. He also had to leave about 3 hours after I'd given birth. So once I was on the postnatal ward, I was on my own. I didn't know what to do with my baby. I was completely lost. First time I took her with me and I was told, you shouldn't be walking around with your baby. The second time I think I left her in the cot, and then I was told someone's baby's crying, and it was mine. And I just felt like a terrible mum. It was all new, it was very overwhelming. And I just felt like there was very little support. So I think for me that first 24 hours in hospital were really tough. I remember I spent a lot of the time crying, not really knowing what to do. Like, nobody really came to check on me or the baby. So I didn't know if I was feeding her correctly. I didn't know if she was okay. And it was just very, very tough and overwhelming. And actually I remember in the end, one of the other mums in the bay went and filled up my water bottle for me. And it was just such a kind thing. What went on, I think, I understand that restrictions were in place, people were dying, but I think they took away some of the human element and thinking about how that would impact people as part of it. Some practical measures I suggested to the hospital post my experience were things like, if it happens again, don't put the women with the C-section furthest away from the nurse's desk. Put them closer. Maybe have a bay of people in C-sections all together, so that you can kind of focus your support on the areas. Like, small things like that probably could have made a bit of a difference.